Hello and welcome. Congratulations, class of 2025. We are so proud of all of you, and we are so glad that everyone can be here today. Friends, family, significant others, important members. We, as the Veterinary Health Center, the faculty, staff, house officers, and all of the members welcome everyone that could be here or virtually joining us through the live streaming opportunity. But this is really an incredible day, a day for celebration, a day for acknowledgement and recognition of all of the achievements that you have accomplished to be here today and to get ready for this next step in your educational journey. And that's really what this is about. This next year is going to be an incredible year. You're going to join the Veterinary Health Center. You're going to join the veterinary healthcare team. You're going to be a very important part of care of patients, management. You're going to learn every single day. You're going to learn from one another. You're going to grow. You're going to finalize becoming clinicians. And that is an incredible, incredible milestone in your education and in your professional journey. So congratulations for that. I would like to take an opportunity to thank everybody that has allowed us to be here today in terms of the College of Veterinary Medicine, our incredible CATS team, our support staff of Catherine Carlgreen, Diane Beats, Anna Harris, and so many that have helped us to put together the event for today. So again, congratulations, welcome, and I am going to go ahead and turn things over to our Dean, Dr. Bonnie Rush, who is our HODIS Family Dean. Dr. Rush.
And now my camera won't come up. I mean, you know exactly how hard this is, right? You guys don't know because it's not hard for you. I am just going to say, oh my goodness, wow. Like, this has got to be the biggest crowd we've ever had. So give yourselves a hand. We're so grateful. We're so grateful that you could all be here today and celebrate with us. And in this important transition between the classroom and the clinical training program, I think this is a good time to remember that we chose you. And we selected from a pool of 1,500 candidates. There were more people who did not get an interview than did. And of the 470 people that we interviewed, there were far more people who did not get that acceptance letter than did. And we picked you because you're exceptional and you've been successful and you're going to continue to be successful. I think it's also important at this transition to clinics to remember that you chose a College of Veterinary Medicine with a teaching hospital. How many of you know, raise your hand, class, what a distributive model school is? Raise your hand if you know what that is. Raise it high. So distributive model, right? No teaching hospital. And you're going to travel to complete your senior year. So today, rather than celebrating this transition for your white coat, you'd be saying goodbye to your colleagues and you would go on the road and you would spend an average of about $17,000 extra in travel, hotels, meals, to complete your senior year, right? So you may or may not encounter practitioners who know where you should be in your training program. You may or may not encounter practitioners who allow you to fully participate, and you may or may not encounter practitioners that will help you with the next stage of your career. Of the 33 colleges of veterinary medicine in the US right now, 5 are distributive models. But here's the thing, of the 11 new colleges of veterinary medicine that are coming online that have received reasonable assurance from the AVMA of accreditation, 11 of them are distributive models, no hospital. And so, why? Why did they do that? Right, it's a less expensive way. That hospital is expensive to maintain. It's a less expensive way to train veterinary students. So if it's less expensive, do they charge less tuition? No. You can see the class shaking their head. No, they don't. Do they perform better on the national boards? Not so far, right? I cannot put into words how much I love our hospital. It is an incredible resource. It is our most extravagant learning tool. And I can walk around for 20 minutes and see 10 or 12 great cases, and so can you. You can walk around that hospital and see what your friends are doing and learn more than just the case that's directly in front of you. And students will ask me, why are you walking around? And I'll say, because I'm looking for good people doing good work, and it wasn't hard to find, right? I walked past orthopedics the other day, and the student said, Dr. Rush, my dog has a drawer sign. You want to feel it? Heck yeah, of course I do, right? I walked past ultrasound a couple of months ago, and you could tell something was happening in the room. And I said, what you guys got going on? 10-year-old male castrated mixed breed dog. It's got prostatic disease. Do you want to see it? Yeah. So they're showing me enlarged prostate, cavitated, looks pretty bad. And they're all kind of smirking, and I don't know why, right? I haven't thought far enough ahead. Maybe some of you have already. But they went, except over here, here's that abdominal testicle. We knew it would be there, right? And so the student had predicted it because she knew you can't have prostatic hyperplasia without testosterone. So she knew that somebody had done a unilateral castration, which is, right, that's a no-no, right? And I remember a day, maybe last fall, where the Weavers had just delivered. They were wiping this calf dry, and I thought, that can't be a newborn. That is the biggest calf I have ever seen. It was a beautiful Angus bull calf, embryo transfer. They'd just done the C-section, 175 pounds. And the owners were elated. The students were so excited. The faculty, staff, everybody was just having a great time. And then the owners dragged me back to the barn to show me that they had done a C-section the day before on another calf that weighed 170 pounds, right? Same embryo collection. It's our most extravagant learning tool, and it is not just a resource for your learning, although that's why it exists, right? It's an incredible resource for the animal owners, livestock producers, between the diagnostic lab and the hospital. Both of those entities from this university serve every county in Kansas by providing service, and the clients that you meet will be so grateful that they live close to a place that has 24-hour care, 7 days a week, primary care, specialty care, emergency care, all species, including exotics, for Dr. Carpenter. And not everybody provides that. Shelter medicine, community outreach, you will not encounter that at every college of veterinary medicine. So my hope for the future is that the teaching hospital does not disappear in exchange for a less expensive way to train veterinary students. My hope for the future is that everybody has the experience that you're going to have. And 1 year from today, in a week maybe, you're going to emerge as graduates who are technically skilled, knowledgeable, practical, with an excellent work ethic, because that's the veterinarian that Kansas State University produces. And employers know that, and employers seek those graduates. I've seen a couple of alumni out here, several. Raise your hand if you're an alumnus of this college. And they will agree, right? Practical, knowledgeable, technically skilled. Look at them all over the place. And we're so grateful. You guys are going to do great in the hospital because we picked you to be here. Congratulations. I have the honor introducing the next speaker. It's Dr. Melissa Hill. She was a 4-year class president of the class of 2024. So 1 week from today, she will walk across that stage and get a DVM. She will also get a certificate in large animal medicine. She is knowledgeable, technically skilled, practical, and has an incredible work ethic. And she had the highest score on the national board exam this year. Well, am I allowed to say that? No? No? The jury will strike that last piece of testimony from the... Please help me welcome Dr. Melissa Hill to the podium.
Thank you, Dean Rush. So as you know, I'm Melissa Hill. I'm the president of the class of 2024. And today I have the honor of bestowing some advice upon you for the next year of your life. Hopefully this is helpful. So this time last year, I was sitting in your spots. And this is when I started to write my speech for this year, because I wanted to tell you guys the emotions that I was feeling. I was very scared. I was very excited, but I was definitely not prepared. But I thought to myself, fake it until you make it, right? So on my first day of clinics, I brought my first client to the exam room, and before I could even introduce myself, she asked me, "Is today your first day?" So it was at that moment I knew that I was not faking it very well. So if you decide to do that, do better than I did. I very quickly learned how to actually fake it, and soon enough I wasn't faking at all. Some of the tips that I've gathered throughout this last year, I'm here to share with you. So the first thing I have to say is not the best news. I do have to be the one to break this to you, but you will be wrong. You will make mistakes. You will give the wrong diagnosis. You will give the wrong medication. You will have the wrong answer in rounds. But the most important thing that you do is you learn something from these mistakes. It's okay to be wrong, and it's okay to do something the wrong way. And a good doctor is not someone who never makes a mistake. It's how they move on from that mistake and how they make it right. So just keep that in mind. You will not be right for your entire clinical year, your entire life even. Always carry more pens than you think that you will need. You will lose them. They will go all over the hospital. Even if you didn't even take it out of your pocket that day, it will not be there. And the doctors are much more likely to sign your script if you hand them a pen with it. One of the most important things that I've learned in the last year is to have an opinion. The doctors are going to ask you, what is your opinion on your physical exam? What did you find? What would you like to do next? And they don't want to hear, I don't know, or I need help. You can say you need help, but say something. Don't just say you don't know. Come up with a plan and have an answer. Most of the time you will have time to go over your case before you have to present it, so you have time to prepare and to think about what you might want to do or what you're thinking that this might be. So always have an opinion, even if you think it's the wrong one. It's less about getting the diagnosis right away and more about learning how to get to the diagnosis. Take pictures. You'll want to look back on what you've done. This year goes by very quickly, and you will have a lot of experiences. You'll make friends that you never knew were sitting in the lecture hall for these last 3 years. Create memories and cherish them, because this will be one of the fastest years of your life. We have tons of brilliant clinicians, just a few of them sitting over here ready to give you your white coats. And you should soak up every drop of knowledge that you have the opportunity to learn from them, because some of these rotations are only 2 to 3 weeks long, and they will go by so quickly. Spend time with the clinicians, ask them questions, ask them how they got to the diagnostic path that they want to do, the diagnosis, why they think things. This is your chance to learn from them, and we have brilliant minds here to learn from. So make the most of these incredible opportunities that you're going to have. Clinics can get very monotonous over the next year. You will spend a lot of time in the hospital taking your orthopedic surgery patient on a walk while you're slinging them around because they can't use their legs. So make sure that you take time for yourself, get away from the hospital, go on hikes, go out with your friends. Don't just live in the hospital, and make sure you do things that you love. And last but not least, have fun. Clinics was the best year of my life. Okay, it was the best year of vet school. You will meet new friends, you will learn more than you ever imagined, and you'll find interests that you never knew that you had. So keep your mind open and your morale high. Best of luck to all of you.
Well, thank you very much, Dr. Hill, Dr. Rush, and it is now time. And so with that, I would like to ask your marshal, Gina Jensen, to help the first row go ahead and get in line. And we are going to go ahead and ask our faculty that are placing coats today to please stand, and we will go ahead and introduce our faculty members. Dr. Matt Basil, Assistant Professor, Anatomy and Physiology. Dr. Jim Carpenter, Professor Emeritus, Exotic Zoological Wildlife Medicine and Surgery. Dr. Ken Harkin, Small Animal Internal Medicine. Dr. Bob Larson, Production Medicine. Dr. Pradeep Malreddy, Assistant Professor in Anatomy and Physiology. Dr. Matt Meisner, Professor in Food Animal Medicine and Surgery. And Dr. Leslie Weaver, Assistant Professor, also Livestock Medicine and Surgery. Okay, here we go. Heidi Anderson. Rebecca A. Arnold. Amy August. Reese Bailey. Kriti Batrai. Chelsea A. Bieberly. Cecilia Violet Biggs. Garrett Wallace Borth. Elizabeth Ann Buller. Maddie Burkhart. Allison Burnett. Lauren Elizabeth Burrow. Unable to be here today, Trinish Bird. Kelly Cameron Harp. Rachel E. Champagne. Lauren E. Clifton. Carly A. Cole. Kaylee J. Conrad. Devin M. Corrales. Victoria Lynn Cross. Kylie L. Crystal. Courtney J. Cullum. Julia Elaine Dickerson. Carly Dill. Kylie M. Doctor. Logan Drucker. Trevor R. Dunn. Daniela Marie Duran. Madison B. Engelbarts. Douglas Farley. Judge Shi Fen. Kathleen R. Fitzpatrick. Aaron Mackenzie Flayhive. Deanna Janet. Kimberly Catherine Glotzbach. Skylar Elizabeth Gray. Lauren E. Greiner. Ian E. Hall. Meredith Halliburton. Madison L. Hallmark. Megan Hamilton, your class president. Matthew P. Hartling. Elise B. Hazeltine. Morgan Renee Huffman. Shalimar Hume. Samantha M. Jansen. McKenna Julia Jensen. Eden Nicole Johannes. Emily Johnson. Bryant J. Carlene. Audrey Kastner. Random Rainey Keegan. Chris Kilili. Danelle J. Kopp. Kelsey Anna Crouch. Michaela K. Locker. Elaine M. LaRoche. Gabrielle Lehau. Danielle Renee Liesenfeld. Sierra Lohr. Mason Lee Loy. Cheyenne C. Lozano. Sarah Marie McFarlane. Kayla Marie Majors. Cassidy N. Mariotti. Orion I. Matthias. Aaron J. Mayhew. Emma S. McClure. Caitlin D. McGee. Ashley Mizell. Catherine V. Melendez Santiago. Marissa A. Mazzadri. Kylie Ann Miller. Sydney Mills. Cody M. Minyard. Sonia Lenore Monero. Heather L. Molding. Megan Rose Mueller. Zaid J. Nyberg. Kelsey O'Brien. Greta Pereira. Caitlin J. Peterson. Kaylee Peterson. Harold H. Phillips III. Emily R. Pierce. Rebecca Richard. Hannah Elizabeth Rhodes. Aubrey Rich. Marilee Robbins. Emily Rodier. Chandler W. Rogers. Catherine Joy Rojas. Francesca Rollerson Clark. Samantha Rushley. Cindy Shep. Christy Ray Seth. Sierra Bryn Sheeli. Jaden Simpson. Taylor Lynette Snow. Andrew John Sparks. Claire Irene Staska. Caitlin Marie Stevenson Salazar. Kirsten Page Stouse. Charlie Ray Straight. Caitlin M. Taylor. Nicole M. Temple. Brianna L. Trent Kielbasa. Rachel Ungles. Olivia N. Uribe. Courtney Nicole Van Est. Avery Wagner. Julia M. Walker. Kathleen K. Wardman. Yi Wen. Abigail White. Winker. Kiera Williams. Megan Williams. Caleb Elijah Austin Wright. Sam Wiley. There's a very important member of the class of 2025 who will always stay close. Darlene Johnson is here today to receive Autumn Johnson's white coat. Please help welcome Darlene Johnson. I would like to welcome your class president, Megan, up to the podium.
Hello, everyone. Thank you so much for being here. I just wanted to give a special thanks to all of our friends and family who have been supporting us the past 3 years. It's really been your love and encouragement that has gotten us here. So thank you so much. Now, if I could have my class please stand and repeat after me. As I prepare for clinical training in veterinary medicine, I will enter into a relationship of mutual respect with my professors, my colleagues, and my clients. Place the health of my patients above all other considerations. Accept responsibility only for those matters for which I am competent. Maintain the trust expected of a healthcare professional. Work toward improving my sensitivity and skills in human interaction and continue learning throughout all the days of my life. I acknowledge my obligation to support and sustain the honor and integrity of the veterinary profession as symbolized by the coat that I now wear. I make this pledge freely and upon my honor. Thanks, everyone. You can now sit for closing remarks.
Excellent job. Congratulations to all. As we finish and get ready for the next steps in your journey, I actually do have just a few things that I'd like to share. Once again, congratulations. And as we prepare to finish up even here today, following up on the remarks of our Dean, Dr. Bonnie Rush, we welcome everyone to come back to the College of Veterinary Medicine. We would like for everyone to see the teaching hospital and to learn about where everyone will be over the course of the next year. And we will have some snacks and refreshments. Before we have our seniors join us back at the clinic, we would like for the seniors to join us up on the stage so that we can get a group photo. You may not know this, but those white coats are not going to look like that much longer. And we would love to capture them right now. And when we go back to the college, we would request that we have parking in the east parking lot so that we can accommodate all of the vehicles. And so with that, we really do. We congratulate all of you on this important academic achievement and your next steps to become clinical members in the teaching hospital. Congratulations to the class of 2025. And in honor of all of you and from those who have had these steps before you, you will find in the pocket of your white coat, if you all reach into the pocket of your white coat, that you have inspirational messages from those that are providing support to you as you begin this part of your journey. Congratulations. Proud for these people right here.